Alright, so before we start, it's always a good idea for this prac to put a bit of paper down like this. Obviously any bits of spillage we can collect and it's easy to clean, so it's just good lab technique if we do that. Now here is a sample of poo in a jar. So as far as owners are concerned, they can collect samples like this at home and bring them into the clinic. If they do collect them at home, they want to bring them in reasonably quickly. If they can't bring them in immediately, then they can store them in the fridge, which is probably not the most pleasant thought for them, but you need to advise them that having them in the fridge is the best way to preserve the parasites. The other thing is with faeces, if it dries out, we often, the parasites often die and the worm eggs get damaged, so we want to keep them moist if they're going to be a long period of time. These Faecalyser containers are designed so an owner at home could push that into a poo sample like that, put this inside and then put the lid on and then drop it into the vet clinic. So they are designed so that owners can collect some poo without touching it, and that plug there is designed, the plug there is designed so it can push straight into the poo sample. You take a plug and then you can just close the lid. So let's have a look and see what we're going to do. We've got a fecal sample here. It's got a label on it. It's got the first name and the surname. It's got the date. It's got the clinic number to identify the clinic. And so we've got the essential information in there. The clinic, the date, first name and surname. There is some other information you could put on there. You could put on the time that it was collected. You could put on how it was collected, which usually it's collected from the ground. Sometimes in vet practices we do collect faeces directly from the rectum of a patient, but the vast majority of the time we're collecting this from the ground. Okay, so we've got our sample. This is the Faecalyser. So we take the green inner insert like this. We take the lid off. We push this into the sample. So we've got a plug of faeces. Put the lid back on straight away. And then carefully, without getting this all over the place, you push this down into the container. Okay, so at that point we've got our faeces and we've pushed it down inside here. The next thing we're going to do is we're going to grab our fecal flotation solution. There's a few different brands, and we're going to fill up some of this to about maybe a quarter or a half weight. And at that point you need to agitate. So agitate means mixing it around, carefully pushing it up and down, giving it a bit of a twist side to side. So we're basically making a poo soup, not very pleasant. And at that point, after you've agitated a bit, what you're doing is breaking up the faeces so the eggs can actually float around in the solution. And the eggs are lighter than this solution, so they're going to float to the top. What we do then is we push down very firmly on the green. So sometimes it clicks into place and sometimes you just need to push down very firmly. Some practices use a stick like this to push down very firmly to make sure it's flat and pushed down. And I'll show you in a moment why that's important. After you've pushed that down, we can continue to fill up. You need to do this carefully. As it gets to the top, you can just put the solution in drop by drop. And what you want to do is to add enough flotation solution so there's a menisci. A menisci is where the liquid is bulging out. And the reason why is because now we're going to grab a cover slip. And when we grab the cover slip, you just pop it on top so it's touching the liquid. So we put our clocks on and we time now 10 to 15 minutes. And the eggs will be floating up and they'll stick on the inside of the slide. So I've got my time on now. I want to show you what not to do. So if we've got a sample like this, and we collect some poo and we push it into the container like that. If we don't push it down, what will happen is, as you fill it up, especially as you get towards the top like this, you'll see towards the edges here, if it hasn't been pushed down properly, it will leak. So you can see the liquid then comes over the edge and spills all over the place. So it's really important, that step, that you mix it, you agitate it, and then you push down very hard on the green insert to make sure it's in place. Okay, so we'll continue here. We've got 10 minutes. We're fast forwarding now. And then we've got our glass slide. We can label our glass slide with your initials on the top so you know which side is up. You carefully lift up the cover slip like so, and you push it onto your glass slide. So this is what it should look like, something like this. You can see there's a lot of things which have floated to the top, and it's sitting on the cover slip, under the cover slip, ready to be examined.